Hi, Simon, doctor at Preston Family Medical, talking about travel medicine. All the doctors here are very confident and happy about talking about travel medicine with you. And the only thing that we ask is that you make enough time, both in time before the travel, and that's because some vaccines and vaccine courses can take a number of weeks to be effective, when we know that we need a minimum of 2 weeks for vaccines to work, and also the length of the consultation. This can sometimes be complicated depending on where you're going, what your existing health problems are, and so sometimes double appointment can be really useful. Now, we are going to ask about your existing health problems, make sure you've got enough medications that are going to cover you across the duration of your trip, and we can ask for extra repeats if needed for longer trips outside of Australia. You are going to need a letter for travelling with, particularly things like insulin, adrenaline we might want to take in the cabin of the aircraft, and talk about safe travel of those sort of medications as well. Some medications, particularly like stimulant medications, opiate medications, some countries in the Southeast Asia and the Middle East need special letters and support for this. We're going to ask about what you're doing. Is it sort of main just resort areas and a family holiday to a main resort somewhere, in which case maybe not much needs doing, or are we much more adventurous? Are we going right over to the back blocks for a long time? Are we doing care work? Are we living in small villages where maybe there's some more risks and some more things that need to be talked about? We're going to talk about your existing health problems and how they might impact on travel. Now, this is particularly for people who might have things like heart and lung diseases, and then some of ththose restrictions, particularly if we're thinking things like distance walked. We often do more on holidays, of course, and altitude. Common things that occur commonly, so actually most things that ruin holidays are things that happen in Australia as well, not weird and wonderful tropical diseases. They're car accidents, they're falls, and they're an exacerbation of your normal health problems. So we want to have good quality health cover that will return you, called repatriation, to Australia if needed, and make sure you're not left in the lurch. We'd love to talk about all those facets of travel medicine with you. So as I said, we just do ask, book in with enough time to talk about all those important things there. All the doctors here at Preston Family Medical are very happy and confident to talk about travel medicine, and we'd love to talk to you and make sure that your next trip stays as healthy and as enjoyable as it can be. Any other questions, book in, call reception to book. We use the online service, and we'll see you here and get you ready for the next trip.